Hey, Dr. Matt Gianforte here today from LifeWorks Integrative Health. What I want to talk about today is a question that I commonly get, and that is, what is regenerative therapy? You see, regenerative therapy is the future of where medicine is going. Regenerative therapy is the ability to use cellular tissue in order to regenerate old, broken down, worn out tissue in your body. There's a tremendous amount of research on regenerative tissues, on regenerative therapies. It's been around for much longer than what most people realize. See, the two most common regenerative therapies today are going to be your PRP and regenerative stem cell therapy. PRP is platelet-rich plasma. This is where a provider will draw blood out of your body, they'll spin it down, and they'll remove the plasma from that. Then they re-inject it back into an injured area. This plasma has a high amount of growth factors, cytokines, chemokines, and what these are signaling cells and kind of like fertilizer that goes into your body and stimulates the growth of other cells in your body. For instance, if you need to regenerate a bone, it would be osteoblast. If it's cartilage, it can stimulate chondroblast. Or if it's just soft tissue, it can stimulate fibroblasts. And these are very immature or baby cells that they go and regenerate and grow and repair damaged tissue. PRP can work very well for patients. In fact, when they compare PRP to cortisone, it actually has a much higher long-term success rate than cortisone. Cortisone actually is just designed to get rid of the pain, and over time it actually breaks the tissue down. PRP does not have any regenerative stem cells in it. That's a myth that a lot of times patients are under the understanding. PRP is a quick procedure. It can be done in an office just right there. And typically it's a little less expensive than your regenerative stem cell therapy. Now, stem cells, on the other hand, they have the ability to differentiate and duplicate into other cells. So they can go in and they can repair and revive old, worn out cells. They can differentiate into bone, cartilage, muscle, ligament, tendon. They can differentiate into other organ cells. So there's a much higher potential for regenerative stem cell therapy than there is for PRP. Now, could you use these two therapies together? Sure you could. So you could actually use the regenerative therapy of regenerative stem cells to get in there and start to duplicate and replicate other bone cells, cartilage cells, muscles, ligament, and tendon cells. And then you could use the PRP to stimulate those and add more growth factors to that. The great thing about regenerative medicine is it's all about regenerating and healing your body. It's not covering up symptoms. It's allowing your body to heal on the inside. And by doing that, you're not breaking it down further. So hopefully that gives you just a little bit of better understanding of the difference or what regenerative medicine is, and then what the difference is between PRP and stem cells. If you need any help with any of your pain and your joint pain and your musculoskeletal pain, give us a call at LifeWorks. Love to be able to help you out and see if there's another option other than taking the route of just covering up and masking your pain with medications and surgery.